Podcast is now starting. All attendees are in listen-only mode.
Okay, excuse me. Okay, this is Alex here with IMS. We are going to be getting started here at the top of the hour. Let some more people kind of shuffle in here. So, do remember this is a live Q&A. You'll see the questions box down the bottom right of your column there. Mine looks a little bit different than yours, so I'm not sure what yours will look like. But this is going to be live Q&A, so I'm going to go through some things and also answer questions as we go. And I will be back here in just a few minutes. Okay. We're going to start here in just a few minutes. Looks like we have some more people filing in. It is 10 o'clock, which I do know a lot of your time is precious right now, and I don't want to take up more time than I need to. So I am going to give it just a few more minutes, see if some more people jump in here, and then we will go from there. Okay, we're going to get started here. So, again, my name's Alex Sealer. I am the National Health Sales Director here for Insurance Agency Marketing. This is going to be the second time we've gone over this tool, but today we are going over it because this is going to have a Q&A function to it. We thought it'd be appropriate to answer any questions that people are having on this tool, what it is, how it works, what to do with it. So, with that being said, Medicare over the years, the whole thing that carriers are trying to do, and I would say companies like the company that we're going to look at the software here, their name is CSG, and many of you were on here when we talked to Taylor. The whole idea to Medicare is, and I don't want to say this in a way that makes it sound belittled or anything of that nature, but it's quantity over quality. And what I mean by that is in the Medicare world, you should be able to be, if you're focused on Medicare and have that as a big part of your practice, you should be able to write significantly more Medicare apps per what you would say an annuity app. And the reason why is because Medicare is a commodity in a sense. Okay. At some point in time, everybody's going to need it. Everybody's going to have it, right? Whether they take a rate at 65, they wait until maybe they're 72, whatever it may be, at some point in time, Medicare is just going to make sense to have over group coverage, even if you do work past the 65 age or whatever it may be. So, with that being said, the reason why tools like this are very integral to should be an integral part of your business is due to the fact of this is a tool that'll streamline your business. I've been working with a lot of agents recently, and they don't write Medicare simply for the fact of they are used to what it was like. Um, just I would say probably 5 years ago, where there's a lot of back office, a lot of back end work that has to be done. Tools like what we're going to go over with today have completely changed that to where this is a streamlined business now. So today, again, what we are going to go over is the quoting tool more in depth, but the main thing I want to also hit at is we are going to do a Q&A session. So do not be afraid to ask me questions in regards to this tool, how it works, what it is, anything you may have in regards to this tool, because I am getting a lot of questions, and that's where we felt it would be appropriate today for my webinar to go back over this again and ask me from a sales standpoint, streamline standpoint, whatever it may be, why and how to use this tool. Okay, so I'm going to pull it up here. Here is the tool. Okay, so this is what it's going to look like when you log in. Now, here's one of the main things I want to go over right off the bat. Let me get out of here and actually take it right back. So when you pull up this tool, and I know they are having to fix this over at CSG. This is CSG. You can see the little logo up here in the corner. That is the CSG logo for those of you that have used this before, but this is our branded account to us and how we operate, okay, or the one that we use. You have to make sure when you're using this tool, you're going to insurancetoolsportal.com /IMS. That IMS has to be there. That is the one that we are paying for. I have a lot of agents and I know they're saving it to their web browser. Unfortunately, for whatever reason, and the developers over at CSG are trying to fix this, and it's taking longer than I thought it would. When you're saving it to your browser, it's not actually saving the IMS version. Okay, it's saving the CSG version. You have to make sure you do insurancetoolsportal.com /IMS, and you have to make sure that this is what you're looking at. This is the screen you're looking at. You have the IMS logo. You can see that this is, especially if you've been to our website, these are the IMS colors. You'll see that's kind of embedded with us. You have to make sure you're on that. Now, you sign in just like normal. Okay. So, going through the app, and let me make sure I have the questions box opened up. Okay. So when going through this, okay, this tool, I keep advertising it to the agents for the most part for the Medicare supplement route, but you can see this tool is actually Medicare Advantage, final expense, the hospital indemnity products, dental, e-applications, the document locker, and scope of appointment. CSG will become our tool that, and again, we will pay for this. And for the time being, I don't see it coming to an end. You never want to guarantee something just in case something were to happen. But for the time being, and I don't see it, like I said, I don't see it coming to an end. We are going to be paying for this tool for you guys. One of the things I like about it is the fact that they're encompassing so many products. I will tell you, they have kind of mentioned and whispered out there that they're even looking to potentially add an annuity function, and that will be very exciting as well to this, and a typical life function. So really, then this can be your one-stop shop for anything that you're writing except for the under 65 market. Okay. Now, I always advertise this on the Medicare supplement side for my Medicare supplement agents. Okay. Here's how it works. Once again, I'm going to type in my zip code here. I always quote a male just because females are always cheap. You know, they tend to be cheaper than the males. And I always quote Plan Gs, right? And we can even type in here your client's name. So you can make this look as streamlined as you need to, right? So I have the zip code. This pulls up my county. If you live in an area with more than one county in the zip code, that'll obviously not be gray. There's a drop down menu and you can really narrow it down. We're around 65 male, non-smoker, Plan G. I want to sort by price. You can see company name, the ratings, the couple different ratings that they have, in price. I always do by price. Effective date, I always go for the first of the next month because realistically, most times that's what you're going to be writing. We'll apply a household discount just because in today's age, we did find out that they're finding that they have more household discounts than not. These carriers are constantly playing with the way a client can handle or can qualify for a household discount. A great example of that is Blue Cross Blue Shield Nebraska right now. Their Medicare supplement in my state right now, in my area that I've been pushing with my agents, as long as you live with someone over the age of 18, you can qualify for the household discount. So, I mean, it's really been played with over the years. Okay. We're going to get a quote here. So you can see here all the different quotes. Now, right here, I know this has kind of stumped some people. What you're looking at right here is when a new application comes into play. Okay, now I always show it. I always make sure I show it because, and I'm going to tell you the difference why. Just remember the screen. Heartland National now has click to apply for their Medicare supplement. Okay, and I'll explain to you why. That's a kind of an important little notice box that comes up right away. So here is Mrs. Jones's zip code, age, all the demographics we were talking about. Here are all the carriers that she qualifies for. Okay. In my personal opinion, I would be going with Aetna Health and Life. Why? Name brand recognition, a little over $2 difference a month. So what we're talking probably $15, $16 really when it adds up in the cents difference. Difference in a year, to me, it would be a no-brainer to go with Aetna. We do have a lot of clients that like the Philadelphia American name as well with New Era. Okay, but my personal opinion, I would go with Aetna in this situation. If you want to, you can adjust this by rate. You can look at Aetna by rate. Okay. Now, in the application, typically, if a client pays for their annual rate up front, it does knock off a few bucks. This is not incorporating that dollar amount, that discount. This is just simply what you can break it down by rate. Okay. This is just simply the rate. Now, it does tell you the household discount they get is 7%, and it does come with a policy fee of $20. Okay. So, again, great feature, great tool. This is something everybody can use. Oop, I am clicking buttons like a madman. Okay. So, another feature I want to go over, and I need to move. I don't think you guys can see it, but I can. I need to move this. There we go. Okay. Here's something some agents have asked me about. Okay. Yes, you can sort this by the carriers you represent. So I always have over here, okay, here's the IMS logo. I don't ever do anything with these. Here's the export tab. And I'll go through that here in just a second, okay? But the export tab, you can print it, right there for Mrs. Jones in front of her while you're working with her if she wants to see it on paper. Most times you can just tilt your computer monitor or show your laptop, whatever you're using. Here's the PDF function. Some of my agents, they like to email this ahead of time to the meeting so they can get a little bit of a grasp of what they're doing and and I'll show you some other functions you can do with the PDF function. And then this Excel actually what it does is it does a carrier data here. We'll pull it up right now. Show you exactly what it's doing. It's going to take a minute. So while that's loading, okay, these are the export tabs. This is something you do. So again, you can print off the sheet of paper for Mrs. Jones. You can email Mrs. Jones ahead of time of the meeting if you want to. And then also here's the rate sheet, okay? And it breaks it down by the rate, pulls it up here in your Excel, boom, gives it to you on Excel spreadsheet. Not quite sure why a lot of agents would use that, but some do, so that it just breaks it down for them. A lot of the agents that like the Excel spreadsheet look, okay? Market analytics. This gives you some more market data, increase history on average, age increases. This tells you about on average what the rate increase is going to look like. A lot of carriers like to look after 5 years, so we're quoting Mrs. Jones at 65, at 66, 67, 68, 69, 5 years, looking at it going, okay, what are their typical rate increases? Over a 5-year period, they're averaging a 1.8% increase, okay? That's in the state. Increase history in the nation, I would say, here's what they're looking at. They're actually at a negative percentage, okay? Philadelphia American is. Philadelphia American, great company. I said I prefer Aetna. This is just choice for you to pick with your client, okay? To me, I like the A-rated companies. This is B++. Everybody knows in the Medicare world, typically, this is just as great of a carrier as an A-rated carrier. Okay, it really comes down to products and some of the things that they throw into the AM Best rating. Okay, and then this shows you national. I do know this information is a little bit skewed. I hope Philadelphia American has more than 172 people in the state of Nebraska that they're insuring, but I do know this is skewed a little bit. There's some things that they're working on that they had implemented that didn't work with the that screwed up the data right now. With that being said, so here we go again. PDF application. You can click this. This will show you a copy of the application. You can click here to download. You can actually print off the applications if you want to. A lot of clients don't like doing electronic. They want to hold it, see it, feel it kind of feeling. Okay, that's what that comes into play. Oop, that went away. Oh, and I guess I should be doing Mr. Jones. I just thought of that since I'm quoting a male. So you saw where the PDF application function comes into play. Okay, you could do the PDF. You can download if you want to. Otherwise, what I really like about this, okay, is right off to here, carrier resources. This will take you directly to the carrier's sales tool portal that they offer on their website for you to use. This is where you can get on brochures, applications, rate increases, underwriting guidelines. You can also write an e-app, okay? So I don't have one right now, but basically what you do is you'd be a new user. You click that, use your writing number you just got. That's how you can log in there. It'll ask you to create a username and password. Now you can get a New Era's website for the remainder of the time. All of these carriers have made user-friendly sales portal tools. You can give me a call if you need to, and I can help you walk through some of those on your end as well. Aetna, same thing. Now, here's one thing that's cool. You'll see here the difference between Philadelphia American and Aetna. Apply now. What this is doing, that apply now, this is what's allowing you to do the electronic application. This will allow you to do an e-app. Right here, you would type in your producer number, whatever it may be. You log on there, you'll see your dashboard changes here a little bit because you're in the e-apps version, okay? This will take you to where you can do an e-app on CSG. The carrier resources tabs, those will also take you to do an e-app, but this is where you're going to be able to get on there to do an actual e-app with Mr. Jones. It's not supposed to be exiting like this, and I do apologize. I'm not sure why it's doing that. Okay, I just got a question here. What if you don't necessarily want to show the name of the carrier initially? Can you blank out the name? Yes, that's what I was going to go over here with everybody here real quick. Okay, so let me get through here real quick. All right. Carrier resources takes you back to the sales tool portal. I'm hoping it doesn't erase my quote again. I don't want to make this confusing. Takes you right to the sales tool portal. Apply now. Actually does the e-app right here on this platform. Okay. I like that a lot because the next cool function that we do have is this software, as long as we've approved it for you and we got your payment going through, which we do cover all that. You don't see any of the payment information. We cover all that. As soon as we put you on our list, you can actually download our application. It's on Apple, Samsung, all those different Google Plays, Apple Play. It is on all that. You can download IAMS Quoting and do this on a tablet. A lot of my agents are using their tablets these days to write the apps. It really streamlines it, really helps out. They can get into the sales portal here. If the client needs a brochure, see some of those things, you can get in there. You can actually email it to them directly, so then they have an electronic version if they want to print it out themselves. If you want to print out ahead of time, whatever maybe you can. A lot of my agents really like using using a tablet or a laptop when it comes right in this business, but it is tablet friendly if you want to use that. Okay. Now, yes, like the question was asked, you want to write Aetna, right? You're contracted with Continental Health and Life. You don't want them to see Philadelphia American, CHS, Central States of Indemnities here. You don't want them to see Equitable National. All you do, come up here, remove, remove, remove. Say you don't want them to see Prosperity, you can remove all these. You can remove as many as you want to. When you do back out of the quote, it will reload all of these. Okay, it'll reload them all. So it's not like you saved it here. So you can show them just Aetna and Lumico. Okay, you got Blue Cross Blue Shield Nebraska here. Okay, I'm just going to exit all these out. Let's say you just want to represent these three. Boom. You can say, ma'am, or Mr. Jones, I'm sorry, Mr. Jones, I have Aetna, Lumico, Blue Cross Blue Shield, Nebraska. And then this is where you can get in there and explain to them your pros and cons of the carriers, what you do not like, what the differences are that you would or would not choose on this. Okay. Some agents are going, Alex, Aetna's right there. Why'd you leave Lumico? Well, Lumico is a great carrier. Lumico is actually backed by Swiss Re. Swiss Re is the largest reinsurer in the world. So Lumico may be in the market only in Nebraska for about a year. And actually, in total, they've only been in the business for 2 years nationally. But they are a great carrier. So they would be able to compete up here with Aetna and Blue Cross Blue Shield. Swiss Re, they're the ones with the white cross red background. Everybody kind of remembers it after you mentioned that. That's who owns Lumico. So no, they may not have that name brand recognition yet like Aetna does or like Blue Cross Blue Shield does, but you can reassure your client this is a really good carrier. Also, Lumico, from an agent standpoint, Lumico runs a lot of cash wraps incentives. They run a lot of bonuses. They have carrier trips, things like that. So not necessarily that's what you want to promote to your client, but from yourself personally, as you're out there writing the business, that's something definitely to keep in mind. I'm trying to think here. Okay, so right here, and a lot of agents have asked me, okay, Alex, you're showing me the carriers. Hold on, let me read this. You're showing us the carriers, but what if the client is age 67? Well, go right up there. Boom. It'll pull up all the carriers again in your area. Okay, a lot of them. Okay, client 67. Now the next question always is 67. They're their guaranteed issue. They're gonna have to go through underwriting. What if they have some issues? How do I know what the underwriting will take? Right here is a very great function. You can get in here and type in a lot of conditions to help kind of weed out some of the carriers that they may or may not want. This is a great function. As you can see, there's a lot of them here. So let's just pick one, for example. Let's say they have, I'm trying to find one that I think is more common. There you go, diabetes. A little bit slow here. Here you go. This will tell you exactly what their breakdown would be on diabetes. Okay. Non-application. Philadelphia American is accepting of it. Look back period currently. They want to know where it's at right now. This is the This is the category criteria. Look back period. They're looking at it right now. They don't look back. Philadelphia American doesn't look back. That's either going to be a yes or no. You can pick more than one at a time, but I don't want to really read this out. I don't want to make it more confusing than it might be already. Heart attack, very common. Right there, once again, shows you the category, the criteria, look back period of 5 years. Okay, so all these carriers are going to be a little bit different, but this will kind of help you weed out. You can see the differences here. Philadelphia American will look back 5 years. Central States, they'll look back 2 years. Okay, so that is a function that you can use to start weeding out some of the things for your clients. Because again, you're wanting to streamline your business. You're wanting to write an e-app, streamline the business, knows if they've been accepted or not. You can start reading out some of these health questions, so you know right away. Oh, Aetna's not going to take them, but maybe Central States will. I can get in there and write an application for them today. Okay, so this whole tool, CSG, as I've mentioned to many of you that are on here, and some of the new people, like I said, I will follow up with you after this webinar here. The whole concept of this tool is to streamline your business, make it as easy as possible. Now, here's a function a lot of my agents like right off the bat. This tool is allowing these carriers also to have their turnaround times be significantly fast. And what I mean by that is you submit Mr. Jones's application within National Guardian Life, I believe they are right around 10 minutes right now. Which no, they're not on this. They are for people. National Guardian Life's really competitive with people that are like 72 and older, somewhere in that age range. Okay, but National Guardian Life is letting you submit an app, and within 10 minutes, it is kicking back to you, letting you know whether or not that client's been approved or not. That is huge. That is huge. Because what does that do? Streamlines your business. Why? If your client has been approved, National Guardian Life comes back and says, "Sorry, we can't accept Mr. Jones." Rather than having to take more time to set another meeting, draw out another meeting to come back through, go through this application again, you can hopefully sit down with them and say, "Okay, Mr. Jones, National Guardian Life is not going to accept you. Let's find somebody that will." It gives you time to fill out another application and get going. Again, eliminates all that back office support that a lot of agents, again, because we're writing more Medicare than we are typically per app count, I guess I should say, than we are annuity. This helps you really streamline and organize your business in a very timely fashion. So this tool has become very popular. This tool has become very helpful in the business as a whole. Okay. Let me pull up some more questions. Okay, let me answer some of these questions here. So we have another question. Alex, this tool is great. I love the way you're explaining it, but what about from a commission standpoint? Will this tool affect my commissions? No, this tool has nothing to do with your commissions. This is a free of charge tool working through IMS, bringing us your contracts and letting me help you in the business. So no, this has nothing to do with commissions. This will not affect your commissions whatsoever. Okay. What if they wanted dental? Okay, perfect. So some of these carriers, that's actually a great question. So you did see on here, let me see if I can go back. Okay, so you do see here, there's Medicare supplement and dental. So there are some agents that write dental separately, but if in the same meeting you're talking to Mr. Jones and he wants a dental plan that's linked to his Medicare supplement, you can do that. So for prime example of carrier, and I'm just off the top of my head, I know there's more that do it, but Mutual of Omaha, for prime example, they have the dental function on their e-app. So when you want to write a dental plan, you can. It'll just be linked to that same e-app. This is just simply for running a quote if you want to do a standalone dental plan, okay? But if a carrier offers it, Guaranteed Trust Life has a cancer, heart attack, stroke rider. That is a great amount of coverage for those three symptoms in the event that one of those things would happen, for a huge lump sum payout of income to help them offset medical expenses, bills, whatever it may be. Again, great option. Okay, we have a question right here. Connecture seems to be dominating the MAPD world. Where does CSG stand relative to Medicare Advantage prescription drug plan e-apps? I thank you very much, Gary, for asking that question, because that's exactly where I'm going to go here. Okay. CSG, Connecture, they are different companies. Connecture is ran by the same company. They are the same company that updates Medicare.gov, helps kick back information. They work very closely with CMS. Okay. CSG is in the process of not copying, but it'll be their own, but they are going to mimic the same functions on the Medicare Advantage side and prescription drug side that Connecture has. So you'll notice here, and I'm going to do it, but we have run a quote for Medicare Advantage PDP, electronic scope of appointment document signing. That is recipe for they are getting ready to allow electronic enrollment in comparison on we have already paid for the function, so all of our agents get it. So once it rolls out, which it sounds like in 2020, our agents will be able to see the electronic apps on CSG for the Medicare Advantage prescription drug world. And we can run that right here. And here you go. So Aetna, Medica, I would tell you, out of all these carriers personally, Omaha is built up of Blue Cross Blue Shield, Aetna, and United Healthcare. There is a little bit of Humana, but yes, the same function will be there. Right over on this side will be a e-app tool that will allow you to do an electronic application on the Medicare Advantage side. Of course, you'll have to get the scope of appointment. You saw the scope of appointment function back at the menu. There will also, I believe, be one right here. So in the event that you're talking to your client, especially if you're talking med subs with your client, and then you're finding through the conversation that's going to be a Medicare Advantage need, and they need to be on an HMO PPO type network and get a certain physician, doctor, hospital network, whatever it may be, you can immediately run the quote and say, all right, ma'am, or Mr. Jones, I'm sorry. We are, we're going to need to probably get you with Aetna here. Let me click here. Hopefully it'll be somewhere over here. I need to get a scope of appointment signed with you. Okay. So there are a few filters here, HMO, PPO, if they want an enhanced drug benefit, things like that. That's where you'll be able to get on there and start cycling through. Okay. Now, Connecture is very thorough, but I do know CSG is going to offer the same functionality, everything like that Connecture offers on the CSG. It's not on here yet, but I have seen a dummy version of it. They are pretty much the exact same thing, and my personal opinion, the CSG one goes much smoother, much smoother. Yep, electronic scope of appointment. So it's right here. So right now, because the reason why they're two separate things is because there isn't an actual enrollment function here yet. So what you would do right now, if you needed to do that, and I know I have some of my Medicare Advantage agents on here right now. So this is actually a really good question. What you would do temporarily, I have Connecture for you. Give me a call. It's Connect for Medicare. I will get you set up with that. That's just let me know your username, and I'll get you your username and password. We can go over that ourselves. But right now, what you would do if you needed to use CSG, you would go over here to get your electronic scope of appointment, get it emailed over to them and signed. I'll pull up right here. Give me 1 second. This is where you start the document. You could download it, print it off, whatever it may be. This is where you can get in there and get started with that. and then you can. We all know how the compliance works on this, okay? But then that's when you can get in there and tell Mr. Jones, hey, I think we're gonna need to get you on an HMO PPO type plan. Here are the options that are in the area. I would love to set a meeting to come back and speak with you in regards to these products. Okay, so great plan, great question. Yes, Gary, that is a generic scope of appointment that can be used with anybody. Unless for some reason the carrier, and I'm trying to think, unless the carrier for some very specific reason enforces their own, no, typically the scope of appointment can be generically used with anybody. You can get in there because what you do is you get in there, you select the carrier you think it may be, carriers that you think it may be, and then it'll start prompting you through exactly what you need to do. Again, you can print or the whole, they allow the print function, but realistically, we really want to try to do as much electronic as possible. I am telling you, I've worked with a lot of agents. I've worked with a lot of agents so far here at IAMS. Last brokerage I worked with 4,800 some odd agents. Of the active ones that went more electronic, their business just seemed, there was a little bit of a learning curve. I'm here to help you with that. The more electronic you can make it, the more streamlined and more your business is it's just gonna go so much smoother for you. Now, here's the cool thing. I don't know who's gonna ask me this, but I'm sure somebody will. Yes, you have to hold on to your scope of appointments. Yes, you have to store them for a certain amount of time. And yes, CSG's portal here allows you to do that. CSG's portal will store all of that information. So if you need to go back to Mr. Jones's application or scope of appointment, you can do so. Again, once I have seen the dummy version of the Medicare Advantage enrollment tool. It is very similar to Connecture. I really like it a lot. It's going to incorporate all. I have the reason why I like CSG's function so much more. I have agents that write a lot of different products. Okay, Connecture allows some MedSup production, but you can definitely tell that Connecture tool is aimed towards the Medicare Advantage. This CSG is going to allow all the same functions, have all the same features, and a lot more products on it. To me, I don't want, just like I don't want 19 different FMOs to work with, I don't want 19 different softwares to work with. I want my one-stop shop. I want my one-stop tool I can go to. I have it all right there, and I can use it. That's why, like I said, the tablet version of this is so nice that they rolled that out because it has just helped out a lot of agents. They can just walk in with their iPad or their Samsung tool, whatever it may be, and use it. Oh, one thing I did forget to show. Yep, thank you very much. Just had a reminder. So there is an educational part to this Medicare to the Medicare supplement side. I don't think I need to keep typing that. I think everybody kind of gets it that I'm doing it for Mr. Jones. Okay. So a lot of agents, they are writing the business but they're also educating their client at the exact same time, right? A lot of my agents that are in here with us today, they are doing seminars, okay, which the seminar, uh, there's two types of clients out there. There's your turning 65s and then there's your 66 and olders. Excuse me. Turning 65, a meeting typically is 50% education, 50% cost, right? What am I paying for? Am I paying for the right thing? Where's my social security come into play? And explaining how social security, each time you've gotten paid in your life, a little itemized list on your pay stub. That's what this is all going towards. What are we doing here, Alex? There is an educational function to this. And let me pull this up. So let's say for the sake of argument, you go back over to Aetna. I absolutely love this feature. Okay. Plan G. This tells you what Medicare pays, right? So when you are in your reaching 65 and you get your Medicare Part A, Medicare pays. This is what your Part A pays for. This plan is stating the Aetna Health and Life Plan G that we're quoting, that's what this plan is. This plan will pay for X. Medicare pays for X, this plan pays for Y. Let's put it that way. Here over here is the you pay. These are the remaining out-of-pocket costs that your clients are responsible for in green. Okay? You can do the same thing with Part B. Shows you, again, X. This is what Medicare pays. Y. This is what the Medicare supplement that we're quoting pays. This is what you pay. This is what the client is responsible for moving forward. This function has helped more agents than I can even explain. This has really, again, streamlined the meeting so clients are starting to understand, okay, this is what it's paying for. Now, before, when I was talking about the PDF function, some of my clients, and for some reason it's hidden up here, but this is a view printable tab, okay? You can print this and actually download it to a PDF. You can send this and a PDF of the quotes to your client ahead of time, which again, they can just look at it. I mean, obviously you need to sit down with your clients, you need to go back over it with them, but they can look at this ahead of time and go, oh, okay. They're starting to get some understanding. I have an agent, what he does is he prints off this, he prints off the quotes that he's going to run them in the area, and also says, hey, Mr. and Mrs. Jones, take a look at Medicare.gov as well. Poke around if you need to. Write down any questions you may need to. I can answer anything you may need. Okay? This is a phenomenal education tool for you to work with your clients on so they can start to understand what they're getting into. Okay, I have Part A, but I had to apply for my Part B. Now I'm paying that Part B premium every month. Wait, what else am I paying for? Oh, okay. I can see here it's also telling me I'm responsible for my Part B deductible, which is different from Part B premium. Okay, but I'm responsible for a $185 Part B deductible right now as well. Can you explain to me what this is? It just helps you get in there and talk with your client right off the bat and say, okay, Mr. Jones, when you applied for your Part B, they told you you're paying $134 and some odd change for your Part B premium. That is what you actually pay through the Social Security office in order to have Part B. Okay. But on top of that, this Part B deductible, the difference is with Plan G, yes, you see your rate here, and yes, you are responsible for $185 yearly Part B deductible. But if you compare a Plan G rate to any other rate, you're going to notice that you're going to save $300 to $500 a year on average going with the Plan G. Oh, okay, yeah, great. Thanks, Joe Blow. I'm ready to get set up. Okay, that's where this comes into play. Again, really helps streamline out the business. Shows you a lot. Waiting for CC some more questions that come through. Yes, IMES is doing Medicare Advantage as well. So as we know, AEP is really busy with that. Now, here's one thing I want to clarify real quick with all my agents that are on here right now. What I have been hearing, a lot of the agents I'm bringing on board is, yes, Alex, I like it that you're talking about Medicare, but isn't it too late? Aren't we already halfway through the selling season? Let me touch on that just a minute. So AEP really is only for people that are on a Medicare Advantage plan and have already been on it. AEP really has nothing to do with someone turning 65, and it has really nothing to do with Medicare supplements other than the fact Medicare supplements do take a spike. And let me explain to you an exact scenario of where Medicare supplements and why they take a spike this time of year. Okay. So turning 65 business is all year round. That has nothing to do with AEP. That is an OEP. That's your open enrollment period where you get a guaranteed issue onto a plan. That has nothing to do with AEP. That is turning 65 business is all year round. Medicare supplement business is also all year round. It doesn't matter if it's January 1 or December 31st. If your client wants a new Medicare supplement policy, you can write them. And the only thing is you do have to go through underwriting, but you can write that any time of the year. Okay. The only time you don't go through underwriting is if it's a special enrollment period or something that enforces, say for the sake of argument, I have I put 5 clients on Aetna when they turn 65, and that's, when they're 66 or even 65, Aetna says, "Hey, we're not taking care of your clients anymore. We're not going to support this network anymore. We're pulling out." That opens up a special enrollment guaranteed issue period to move over to another carrier. Okay, but AEP is really for HMO, PPO, Medicare Advantage based plans and prescription drugs to flip in and out of some benefits. Maybe some carriers have dropped some current plans, and so a client needs to make a change. Maybe a carrier has rolled in better benefits and they need to make a change. That's what AEP is for. Now, you will see a spike in Medicare supplement business. And as I said, I was going to give you an example. We had a client who he's here in this agent lives here in Nebraska. He has clients that live in Nebraska 6 months of the year, Florida 6 months a year. They have a Florida house. They were on the male, he was 68, and the female, she was 66. And he goes, "I am on a Medicare Advantage plan, but I live in Florida half the year. How does that work? If something were to happen, I'm out of network and I'm paying like crazy for being out of network." Well, a solution there would be that's because they should have been on a Medicare supplement to begin with, and that's a great opportunity to get them on a Medicare supplement. Why? Medicare supplements aren't HMO or PPO based; they're national. As long as that doctor accepts Medicare, your client can go to any doctor anywhere, and their Medicare supplement will be accepted as long as they pay that monthly premium. So, this also has drummed up a lot of questions. Alex, why would I want to sell Medicare supplements or Medicare Advantage, or vice versa? That is between you and your agents or your clients. I'm sorry. That is all dependent on how your clients operate. To me, personally, my personal opinion, if you can afford a Medicare supplement, it's a no-brainer to go with a Medicare supplement. I'm not locked into a certain physician. I'm not locked into a certain doctor or hospital. I, my physician I'm on, he accepts Medicare, obviously, so I can still go to him. But in the event that I have a Florida house and I live in Nebraska, if I'm in Nebraska, Florida, or in between, and something happens to me, I can still go anywhere and not pay an arm and a leg for it. Okay. When someone turns 65, the average they're going to be paying for their Medicare supplement annually is, say for the sake of argument, it's probably anywhere between $1,500 and $2,200 a year, I believe, is what the average is. That's including paying for your Part B deductibles, and but that is not including your Part B premium. Okay, we're just talking simply the Medicare supplement here. Part B deductible, they're paying for it, where the average Medicare Advantage plan right now is hovering between, I think they said the national average is $4,300 to $4,600 a year max out of pocket. Yes, you have a zero premium, but you could end up, in the event that you have to go to doctors, you have to get into use, you could end up paying a lot more during the year and be locked into an HMO and PPO. Now, Medicare Advantage, some people love it, and I'm not going to knock that whatsoever. It's, again, it's just, you're the agent. What do your clients need? I think the questions are starting to slow down. Oh, someone's typing something. Yes. Okay. So if you do have a tablet or a laptop, whatever it may be, this does require internet. I mean, myself personally, I have a hotspot that I use, and business expense because I just leave it in my laptop bag, or I just have my tablet and my laptop all in the same bag. I just flop it on and put it back in my bag, and then I have my hotspot. If you don't have anything like that, I definitely would suggest, I always will send you a box of applications to have on hand. I would suggest you just keep it in the box and put it in the back corner of your trunk, and then you do have paper version in the event that there's no internet. Okay, yes, I mean that does happen. I mean, we all know technology. Lord knows, technology gives me more of a headache than anybody else probably. But yes, I mean that does happen. Um, yes, you definitely need to have internet function in order to do the e-apps and the carrier resources. We have another question coming through. Oh, no. Yeah, no problem. I know I tend to get on here and drag these things out, and I do apologize. And I know everybody's time is very precious, especially this time of year with AEP, but we've just had a lot of questions, and I really want to nail as much as I possibly could. Uh, we can always take this offline. Call into me. As many of you know, I'm very persistent. I try to be as much as I can. Call into me. Let me know what I can do to help you. But yes, this tool is free of charge. I definitely suggest you use this. It is just a very good tool to use, and it's like I said, it's about $1,200 value over a year, and we pay for it free of charge to you. Oh, I have a question right here. Can you preload a fillable app to be printed prior to going? Yes, yes, you can. So if the carrier allows you to do that, you can. Now, here's the thing, and I'm going to say this. We all know compliantly we need to be dates and signatures cannot happen without the clients. Okay. So yes, you can preload the app, you can preload everything if you need to. My thing is you can sell over the phone all of these functions, whether you have the actual e-app like Aetna, where they actually allow you to do the e-app here on CSG, or if you have to go through the sales portal. Both functions allow you to sell over the phone and collect your signatures and dates over the phone. So if you are going to preload the app before you go to the meeting, my opinion is just finish it over the phone and then copy it, print a copy of it and send it to your client. Um, but yes, you can. There's a lot of different ways you can play with this. I just always make sure I stress and hesitate. Make sure you're checking your compliance, and make sure you're checking your marketing guidelines, and make sure you're following in the right lines to where you're not. You need to make sure your dates and signatures are being done compliantly. Uh, and sometimes agents can get a little. I have had an agent. He got in a little bit of a gray area there, and luckily it was just a little bit of a slap on the hand for him. But yes, to answer that the very long way, yes, you can preload it. Yes, it is. So, lastly, is the generic scope form okay with the carriers? Yes, it is. When you go through that scope of appointment function, there is a generic one, and then there's also ones that the carriers recommend. You just click on there. Once you go through, I don't have my writing number here, or I don't have mine. I'm just not linked to the CSG. This is our company account, so I can't actually go into that function, unfortunately, right now. Um, but when you get in there, yeah, it's very self-explanatory. It'll show you exactly which one's the generic scope appointment that the carriers will accept. It'll also show you the ones if, like I believe WellCare right now, they have a very picky scope of appointment. Theirs is on there for you to choose. Yep. So, one more time, the Medicare Advantage enrollment function, like what we have with Connect for Medicare, that is rolling out the CSG. They've not given me a hard date. Now they have told me early 2020. There are just some things compliance wise and systems wise that they have to get done, and we all know how technology can work. But yes, the reason why there's electronic scope of appointment and you can quote the Medicare Advantage right now is because the last piece of that pie will be allowing you to do an electronic enrollment. This will probably be our advertised one-stop shop for your Medicare products. Just due to the fact that all the med subs will be on here, all the Medicare Advantages will be on here, plus things like hospital indemnities. That's really popular cross sell with the Medicare Advantage, obviously. Dental plans, things like that. That's all going to be able to be quoted right here on the tool. And like I said, I did catch word that after they accomplish the Medicare Advantage side, I do believe they've kind of whispered that they're looking at tackling the annuities and traditional life insurances, single premiums, all that. So that way, then this tool can be a one-stop shop quoting and rolling software for you to use. So he's asked. There was a question if that's regional carriers as well. That's kind of a hard one to answer. Typically, right now with Connect for Medicare, in order for the carrier to be on there, you have to be ready to sell, but Connecture has to allow it. They have to be contracted with it. So, for prime example, there's a down in Texas, there's a company called Baylor Scott and White. That's a very popular Medicare Advantage carrier in the counties that they're in, but due to the fact of them just being such a small network, they are not on the Connecture platform. So that's kind of a hard one to answer right now on what CSG is going to look like, because CSG right now quotes anybody and everybody in the Medicare Advantage world, where Connecture, in order for it to quote it, you have to be licensed with it. So I don't know the answer to that. I would say, due to the way that they quote right now, unless for some reason they have to change something, yes, your regional carriers will be on there. Yes. So, and that was going to be my next thing. So, typically, in order for the way that Medicare Advantage works is top of hierarchy. Everything from bottom to top of hierarchy has to be licensed and ready to sell in order to get credit or have it. And what I mean by that is I don't know how it's going to look because I, we can only have so many carriers, right? That's why we put up the main players. We have the United Healthcare, Aetna, Humana, WellCare, SilverScript, Anthem. We are potentially going to bring on Envision RX next year if they can play a little bit better in the sandbox than they typically do. But the reason why is because they have more of a national presence. Mutual of Omaha, we do have their PDPs. The problem we run into, like for prime example, Baylor Scott and White, there's a lot of due diligence from an FMO standpoint, like IMES, for us to have that carrier, and with it also just being a very, very small network carrier for us. Okay, so it does come out kind of what we're looking for. Now, I'm not saying that we wouldn't not add a carrier for you. You just need to let me know what it is, and I'll do some homework for you. But typically, and I am curious to see how CSG rolls this out, but typically, top of hierarchy to bottom of hierarchy has to be licensed, ready to sell, certified, AHIP certified, all that before functions like this can be used. A lot of compliance with the Medicare Advantage. I know I've gone over that with a lot of individuals. I do, by the way, have the 2020 marketing guidelines. If you are needing those for a refresher, let me know and I can email those over to you. Um, because they have updated some of their marketing regulations compared to what they've had in the past. Got a few more minutes here. Just waiting to see if any last minute questions come through. I'm getting private questions, and I'm not sure if you guys can see the question box or not. But I'm getting private, and I'm getting where the whole group can see. Yes. So, yeah, that's a really good question. So, yes, if you are an agent and you're looking to bring on an agency, or even if you have, 3, 4 people, that write Medicare and you want to take advantage of it and maybe earn some spread on what they're doing, everything I offer on the Medicare side to you as an agent, you can offer to anybody you bring on board. And I strongly suggest doing that. We do have, you just need to let me know how many agents you're thinking of. I just had an agent actually. He has about 5 friends that write in the Medicare world, or in the under 65 health insurance world, and all of their books of business are aging a little bit. So he said, I'm going to take this opportunity to build myself an LLC. Alex, you help me train them, make sure they get all the tools and are operating the correct way. There's no reason that we can't turn our under 65 business into business on the Medicare side. That's absolutely accurate. Anything that we offer, you offer to agents and bring them on board. and just let me know. We can play with it. There are spreads, there are commission levels to allow you to do that. Yep. So a lot of our agents are using the Medicare side, Medicare Summit side, the Turning 65 business to not only service clients and find new clients, but also to roll them over to annuity. So I think one of our biggest messages we have is, let me help you with your Medicare insurance. Also, hey, you had a 401k, something like that. Let's look at a rollover type strategy to roll them over to an annuity plan. I would actually say that's probably our more common cross selling from health to life insurance strategy right now is finding those retirement clients and cross selling them over to the annuity side, which everybody knows underneath our annuity platform, I can help you get lined up with whoever you may need. Yep. So I will not have an edited version of this. They always have to edit mine just because I always have really long webinars, and I do apologize. But I will actually get a list of everybody that's on here right now, and I will follow up with you hopefully by the end of the day today. I don't see why I wouldn't be able to. So, yes, you will be hearing from me, and let me know if you have any questions then as well. Oh, thank you. Yes, I appreciate. Yep, I'm here to help. So no, I appreciate that. Thank you very much. I just had someone say thank you very much for showing me this, and I've appreciated it. Yep, no problem. Okay. Well, I think that's going to be it for now. If you guys have any questions, once I hang up here with you guys, I am going to go back to my desk. So feel free to call me 800-255-5055. Again, it's 800-255-5055. I'm going to put in this little group box. Ask for Alex. And everybody have a great day. Thank you very much for joining me, and we'll go from there. You will be hearing from me.